Welcome to our YouTube channel. For most people around the world, when they hear HPV, the first thing that comes into their mind is always cervical cancer, right? But what if I told you that there is more to the story than just cervical cancer? Stick around as we dive into this talk. We want to know the untold story of HPV. Which side of HPV hasn't been told enough? Stick around. Thanks to all of you who like, share, and subscribe. We really appreciate that. So HPV stands for human papillomavirus, and by far it is the most commonly transmitted sexually transmitted disease affecting millions of men and millions of women worldwide. So this tells you how notorious and how deadly this virus is. And it affects more than 90% of sexually active men and more than 80% of sexually active women, but symptoms are masked, so it doesn't show, but people are spreading it silently. So when we talk about HPV, very many people just think cervical cancer, but there is more to it, and that is the problem. Over 69,400 men get HPV related cancers every year. 1 in 3 men with HPV get genital infection, like in the anus or in the penis. And 1 in 60 men gets HPV related oropharyngeal cancer every year. And we have over 36,068 men which get HPV related cancer of the penis every year. So this shows you that HPV is cervical cancer plus all these that I'm mentioning. There are over 200 plus known subvariants of HPV, and we have the cutaneous, the one which affects the cutaneous epithelium causing warts, and the other which affects the mucosa of the mouth, anus, throat, penis, vagina, causing cancer in these regions that I've talked about. So HPV is this deadly. The variants 18 and 16 cause cervical cancer and anal cancer. 6 and 11 cause genital warts. We have genital manifestations of HPV, and it can present as genital warts, as cancer of the cervix, cancer of the vulva, cancer of the vagina, cancer of the anus, cancer of the penis. So this is one of the ways, rather many of the ways in which genital manifestations of HPV can show up in an individual. Other manifestations can be mouth or oral cancers, laryngeal cancer, which is cancer of the throat, pharyngeal or throat cancer, and some studies have also implicated HPV in cancer of the bladder. So again, as we can see that HPV is more than just cervical cancer. Well, thank you so much for all of you who have been tuning in, liking and sharing our videos. Thank you. We appreciate all of you, and all your efforts are always noted. Thank you for the feedback. Thank you for the likes. Thank you for sharing the videos. Thank you for subscribing. We are growing thanks to you. And YouTube recognizes all your efforts. It shows other people our videos, and that is how we are able to spread this awareness across the globe. And thank you as you do that. So let's dive back in. How is HPV transmitted? HPV is transmitted from the lesions of an infected person to a healthy individual through contact, either with the skin or the mucosa. So sex is one of the ways. The types of HPV that affect the anus, vagina, penis, the vulva, and the penis, yes, they can be got through vaginal sex, anal sex, oral sex, even using fingers. Yes, digitally, using fingers, you can pass HPV from an infected person to yourself. So be careful out there. What are some of the signs and symptoms that show up when someone is infected with HPV? Like I said, it is a silent culprit. It will infect someone and keep spreading in the communities without signs. But some of them appear as genital warts, which are soft polyps with rough surfaces occurring in clusters, and these can be painless or sometimes itch and cause burning sensations or discomfort. And so this is how HPV shows up. In men, the warts can be under the skin, the foreskin of the penis, on the sides of the shaft of the penis, within the urethral opening, around the anus, in the rectum, even the nails and fingers. So genital warts or warts actually can appear on all these parts that I've mentioned in men. So as you can see here in the picture, you can see genital warts and then warts here on the finger. In women, they will appear on the vulva, on the vaginal wall, on the cervix, perineum, anus, the rectum, and the urethra. So these warts can appear anywhere. Of course, with cosmetic challenges, someone will have a wart on the body and they will not feel very nice about it. So you can see how HPV is challenging. How do we diagnose this notorious element, HPV? So physical exam plays a role, but cervical and anal pap smears, colposcopy and anoscopy, HIV, nucleic acid amplification tests, and routine oral examinations for any lesions can help you catch HPV very early. So in case you've been diagnosed with HPV, how do you treat? If you have the lesions like the warts, we can excise them by reducing the bulk, using caustic methods or lasers like trichloroacetic acid, but also topical medications like antimitotics, which stop further growth and enlargement of the warts like podophylotoxin, or even interferon inducers like imiquimod. These can be able to help you to fight off the HPV infection and the warts. Point of note, please, relapses are very common, especially in immunocompromised individuals like people with advanced HIV disease. But in immunocompetent individuals, the warts may actually resolve. Many people who get HPV do not get the signs and symptoms, but this makes them to pass on the virus silently, which makes HPV prevention really difficult. And the more the number of sexual partners that someone has, the higher the chances of getting other variants of HPV. Remember, I talked about the 200, so really watch out. How do you keep safe? Be faithful to one partner, one sexual partner at a time. Vaccinate all young boys and girls between the ages of 9 and 12 to protect them from the virus. And the vaccine can be given up to age 26, but also in high-risk individuals, you can get it even if you're after the age of 26. After consulting your physician and weighing the risks and all, we can still give you HPV to give you a little bit of protection from the virus. So there are two common vaccines which exist. We have a 9-valent vaccine and a quadrivalent vaccine. And this protects the HPV strain 11 and 6, which cause 90% of the cases of genital warts. But also remember we said 16 and 18 are implicated in cancer of the cervix and also cancer of the anus. So I hope that with this information, we stop telling the one-side story of HPV and cervical cancer. HPV goes beyond cervical cancer. It is notorious and implicated in other types of cancers. So vaccinate all people, men and women, vaccinate all children, boys and girls, and protect them against other things that come with HPV infection. Remember that men are actually the higher population that are infected, with over 90% of sexually active men and 80% of sexually active women. Keep safe, limit your number of sexual partners, use a condom, and be faithful to one person. I hope that you all take care of yourselves. Keep subscribing and liking and sharing. We shall see you next time. Thank you so much.